Hospital middle management has had to deal with numerous reforms since the Juppé ordinances of 1996. After accreditation, activity-based pricing, and the management of the right to make mistakes, it was information and communication technologies and then AI that came to disrupt daily hospital practices with the aim of rationalizing care and controlling costs. Middle managers are the first to be affected, as they must manage the coordination and delivery of hospital care, as well as the management and dissemination of knowledge stemming from these new technologies in their daily work environment, all while having only a limited right to make mistakes. Hospital middle managers must respond to multiple pressures related to the introduction and management of information technologies and the integration of AI into diagnostic and care processes. They must also manage new knowledge within their own departments and among their teams. Testing technologies, learning appropriation and integration of new computer-based informational sources. At the same time, they must carry out organizational management tasks for their teams, coordinate between departments, maintain the productive apparatus, oversee diagnostics and care, implement legal monitoring in line with patients' rights, and finally handle financial reporting to internal departments and to the Auteur.e.s, the regional health agency. The time devoted to these new tasks now prevents them from providing individualized and close management of patients. On the contrary, the rationalization of care and the focus on anticipating patient trajectories on a large scale within the hospital lead to a dehumanization of the patient-caregiver relationship. The acceleration of tasks and the reduction of time spent with each patient result in a profound change in care and in human relationships with patients. The status of the patient is shifting significantly toward a system of medical coding management, of treating homogeneous groups of patients, and of sequencing care so that the individual spends as little time as possible in the hospital in order to optimize the time of healthcare staff and the efficiency of hospital technical facilities. This time, now measured and managed by middle management, acts as a force of dehumanization within the hospital. The management of computerized legal and economic documentation, now omnipresent, represents a challenge for hospital middle managers. Previously, they defined their roles and skills within a culture of social interaction in the present moment, where spoken communication took precedence over written, as so well studied by Goujon and Lacoste in 1995 in their book on communication in hospitals. The daily management of services was then based on an information flow that was primarily oral and focused on the present moment. Middle managers must now co-manage, alongside artificial intelligence, information flows across multiple organizational settings, present and future, social, economic, and legal. In conclusion, the loss of a large part of the oral culture among caregivers, as well as between caregivers and patients, due to the arrival of AI and new information technologies, leads to a dehumanization of hospital missions for patients in favor of the economic efficiency of the technical care provided. Hospital middle managers must therefore acquire new legal, economic, and IT skills that were not originally envisioned as part of their chosen profession,